Karl Anthony Towns tore his meniscus and is going to have surgery. We're going to explain what the meniscus is and what kind of surgery he's most likely having. My name is Dr. Marco Lopez, Doctor of Physical Therapy, Certified Strength and Conditioning Specialist, and co-founder of the Basketball Doctors. So Karl Anthony Towns tore his meniscus and now will have surgery. So before we go into what kind of surgery we are expecting for him to have, let's talk about the meniscus. So the meniscus is the cushion of your knee joint. So it's little round shapes. There's both on the medial and lateral side, and they provide support and also stability. And what happens when you tear this meniscus, you lose some of that cushion and also some of that stability. And a lot of times when people tear these meniscus, most of the times it occurs with some kind of traumatic injury, meaning you plant your foot and you have some kind of twisting or rotational aspect with your foot planted, and that leads to that meniscus tear. However, there's a lot of people that do tear their meniscus over time. Just normal wear and tear. As you put more and more load, it just slightly grinds the meniscus. But Karl Anthony Towns most likely had that traumatic injury, and it didn't happen in the game, it most likely happened in practice. So this meniscus, after you tear your meniscus, there's a couple things that would happen right after. One, there's probably, if it's a traumatic injury, there'll probably be some swelling in the knee joint, and also some joint line tenderness, meaning it hurts across your knee joint, right in between your kneecap on the either side, the lateral or medial side. And also, the most important thing is you want to find out if you have mechanical symptoms. And these mechanical symptoms are either clicking or locking of your knee joint. So meaning you try to move your knee and then it just locks up on you. Because if it locks up on you, it's because that meniscus tear might have flapped over inside the knee joint and causing that locking there. A reason we say that's important is because of the next aspect. When you tear your meniscus, there are a couple routes you can go. There's the non-surgical, which we highly recommend for people that don't have any mechanical symptoms. So if you have swelling and some joint line tenderness, but you don't have any locking or clicking, the non-surgical route will most likely benefit you significantly. Meaning you first decrease the swelling, you work on your range of motion, work on some impairments of strength, and slowly get back to the activities you want to get back to doing. It takes a little longer, but as long as you're patient, you'll get there. However, if you have mechanical symptoms locking, which we think Karl Anthony Towns had, then you're going to go through the surgical route. And there's three main surgeries for a meniscus tear. The first one is a meniscectomy. The meniscectomy is what we think Karl Anthony Towns had, because the meniscectomy will remove the meniscus, and the recovery is very fast, usually anywhere between 6 to 8 weeks we've seen, sometimes even a month for some players. So what this is that they remove the meniscus, but because they remove the meniscus, that part of the meniscus is not there yet. So meaning long term, it increases your risk for any cartilage injuries and any other issues because you don't have that stability anymore. They're not going to remove the entire meniscus, they're just going to remove the part that's torn or that little flap. So quicker recovery, but long term health for your knee, not so great. The second one is a meniscus repair. The meniscus repair will actually repair the torn meniscus, but the recovery is much longer, several months, because you're not able to place weight on it, anywhere between sometimes 2 to 8 weeks, depending on the surgeon's precautions. And because of that, you lose a lot of muscle, and then you can't bend your knee past 90 degrees for a certain amount of time because you want to compress the meniscus. So it takes a longer recovery, but greater benefit for your knee long term. The third one is the meniscus transplant. The meniscus transplant, not a lot of NBA players have, some of them do, but that's when the meniscus is fully torn and they want to replace the entire meniscus. And usually sometimes it's because people have torn the meniscus multiple times. And when they have the meniscus transplant, you're looking at even longer recovery, close to a year. So to recap those three surgeries, one, the meniscectomy, shorter recovery, but long term, not so great for your knee. Meniscus repair, longer recovery, great for your knee down the line. Meniscus transplant, longer recovery, but not as common. With Karl Anthony Towns, we're expecting, because the latest research has shown that he will be out for at least 1 month, they say, we're looking at more meniscectomy. But the problems with going back to sport that fast is because they remove the meniscus, you might have that swelling issue. The knee joint just might be not ready for that increased amount of load that it has once it goes back to the games. That's what we had with the Celtics center, Robert. Williams, where he went back after meniscectomy after I think it was a month, and then his knee started swelling up, and then he started having some long-term knee issues. So we're hoping Karl Anthony Towns takes his time, but he will have that meniscectomy surgery, and you're gonna look at him coming back, like they said, a month, but the first week is just calming that swelling down, working in that range of motion, getting his strength back, and then slowly getting back into the court. If you have any questions regarding meniscus injuries or about Karl Anthony Towns injuries, comment below. We'll try to answer them. Hopefully you guys learned about the differences between the 3 surgeries and the non-surgical route, and what are the symptoms of a meniscus injury. Hit the like button, subscribe button, share with your friends and family. We are the Basketball Doctors. Let's ball for life.